everyone, this is Dr. Serena Vance with OBGYN Associates with St. Bernard's, and I'm here to just talk about the COVID vaccine in pregnancy and breastfeeding. And so there's a lot of things we don't know, but let's talk about what we do know. What we do know is that women who get COVID when they're pregnant are at increased risk for having severe outcomes, including respiratory distress, cardiac issues, being intubated, death. There's also an increased risk to the baby. If you become severely ill, we're at a much higher risk of having to deliver preterm. And there's also been some correlation with miscarriage and stillbirth. And so those are kind of the main big things that we worry about with our moms who get pregnant. And those things are about 5 times elevated above the general population who also can get COVID. So the thing we want to talk about is the vaccine. And unfortunately, we don't have any studies on women who were pregnant who have gotten the vaccine. There were a small number of women who ended up being pregnant during the trial, and those women who were pregnant who did receive the vaccine did well and had no effects as of what we have seen to their babies. So the way the mRNA vaccine works, it's very fragile. It does not last in your body for more than 24 to 48 hours. It should not cross the placenta because of the way that it works. And so there shouldn't be any effect on the baby. We're actually hopeful that when you produce all the antibodies, those would cross the placenta and maybe give the baby some protection. So it's really kind of like your body sending flyers out all over saying this is what COVID looks like. So if your body's exposed, you have an army ready to fight it. We believe that it is likely very safe to have in pregnancy and in breastfeeding. Again, in breastfeeding, hopefully you would make antibodies that would help protect your baby. Now, we cannot say this 100%, as again, there are no studies that have been completed, but what we believe and how the science works, we feel it is likely very safe. SMFM, which is the High Risk Society, and also ACOG, which is the American College of Obstetrics and Gynecology, recommend that this vaccine be accessible to all pregnant women. We really encourage you to talk to your doctor or your provider about this in further detail, and there's also information available on the Pfizer and Moderna website if you'd like to read further. So I hope this gives you all some reassurance, and please reach out to your providers again for any further information. Thank you.